This PowerPoint is medication administration specific to parenteral medications, subcutaneous, intramuscular, and intradermal. We'll also discuss pulling up medication from a vial and all the intricacies involved with the application of administering medication in a parenteral format. For this particular PowerPoint, we will be discussing the rights of drug administration and related professional responsibility for safe medication practice, including infection control and client teaching. We will be applying guidelines and precautions for safe medication administration and describing principles used to safely prepare and administer the parenteral medications. These are the 3 checks of medication administration. We will be practicing these in the lab, and Professor Madden discussed this at some detail in the previous PowerPoint. And the 6 rights of medication are true and should be followed no matter what type of medication you're administering. Again, Professor Madden described this slide in detail on the last PowerPoint, but I wanted to include it to make sure that you continue to follow these rights of administration. You will identify your patient, you'll check the identification bracelet and verbalize, have them verbalize their name, date of birth, and ask them if they have allergies while looking at the name band and looking for an allergy band. You will compare that against the medical administration record and the electronic medical record, as you did in the other administration of medications. And make sure you follow these steps no matter what type of medication that you're administering.
So parenteral medications are given either subcutaneously, intramuscularly, intradermally, or intravenously. Those are the 4 ways that you will learn to give parenteral medication. There are others that are not in the scope of nursing practice. And then an intraosseous injection is sometimes in emergency situations, they'll use it where they drill into the bone marrow and they can give medication. You can give the same medications IV or intraosseous injection as you can intravenously, but you have to be specially trained to do that. That is within the scope of nursing practice, but you have to be especially trained for that. So you want to make sure that you choose the right equipment, especially for injection. So you want to look at how you're going to be giving it, the route of administration, how thick or viscous the fluid is, and how much is going to be administered. Also the patient's body size and the type of medication. We're going to talk more about each of these. So this is just a little diagram of the different parts of a syringe. So you have down at the bottom, you have the needle. Now most syringes come with an interchangeable needle, so you can take the needle off if you need to switch out the needle. And also attached to that needle is usually a safety guard cap so that you can dispose of that needle safely. And if you look just to the right of the needle, it'll show you there where the bevel is. The bevel is just a little slanted lumen. So there's 2 different types of needles. There's blunt needles that the bevel, there's no bevel, it's not slanted, it's just straight across, the opening is straight across. You would never give an injection with that. The blunt needles are to withdraw medication out of a vial and into the syringe. But the needles that have the bevel are the ones that you use to inject into the patient's skin. Moving up above the needle is the hub of the needle. That's how it attaches. Now, most needles and syringes are what they call lure lock, where you twist them on together and they fit on there without kind of locks into place so that the needle doesn't come off. There are some syringes that are not lure lock. That's called a catheter tip. But most of them nowadays are lure lock to to keep that needle from coming off when it when it's not supposed to. And then you have the barrel of the syringe, and notice that there are markings on that barrel of that syringe, and different size syringes have different markings. So we're going to let you look at syringes so that you can kind of tell the difference between the two. And then you see up toward the top of the barrel the little black part, that's the tip of the plunger. So the part that is reaches out to the wall of that barrel, that's where you're going to measure the medication from. And then you have the plunger, and that's how you get that, deliver that medication. You draw it up using the plunger, and you deliver it using the plunger. So when you go to draw up medication, if you have medication that's in an ampule, which is a little glass container that has a very thin neck, you want to make sure that all the medication is down below that thin neck. So ampules are always glass, and some medications you can't be put in plastic because the medication seeps into the plastic. So if it's a single dose, one-time use medication that needs to be in glass, so it'll usually comes in an ampule. So what you have to carefully break that neck, and there's some pictures on the next page. And then because you may get little pieces of glass down into the medication, you need to withdraw the medication from that ampule using a filter needle. And then once you've opened it, if you don't use part of the medication, then you have to discard the rest of it. And then before you inject the medication, you're going to replace that filter needle with an appropriate needle for injection. So here's some pictures just showing how to open the ampule. So what you want to do is flick the ampule to make sure all the medication is down in the bottom part below that thin neck. You can also take the medication, hold it in your hand, and shake it down so the medication can fall down. And then you want to take a piece of gauze, and you want to hold the bottom and the top with separate hands, and you want to break it away from you. And you have ampules in your nurse pack. We're going to practice this in the skills lab. The reason you use the gauze is to keep from cutting yourself. And then you can either tip that ampule upside down, or turn it upside down, and the hydrostatic pressure will keep that medication in there, and you can withdraw it out that way. Or you can just set it down on a table and put the syringe in there and draw the medication out. But again, with an ampule, you always want to draw medication out with a filter needle in case there's some little pieces of glass. All right, so when you want to remove medication from the vial, so vials can either be glass or plastic, and they usually have like a rubber stopper at the top, but they can be either single-use or multi-dose use vials. So multi-dose use vials are only good for 24 hours once they're open, so you need to date and time those on the label. Make sure every time you enter that medication vial, you're going to rub it pretty briskly with an alcohol swab to make sure that you clean it off thoroughly so you're not introducing any bacteria or pathogens into that vial. And then what you're going to do is you're going to pull back on your plunger of the syringe. You've already calculated your dose. You're going to figure out how much you need. You pull back. You're going to inject that air into the vial, and you're going to inject it above the level of the medication so that you're not inadvertently getting medication that's not needed onto the needle that you're injecting with. All right, so this just shows you more of the same. So you're going to swab it off. You're going to pull back on your plunger to the amount you're going to need. You're going to put that needle into the vial and inject that air in. And so that creates like a negative vacuum so that when you pull it back, it's easier to withdraw the medication. Then you're going to turn it over and make sure the tip of the needle is inside the solution, and you withdraw the medication back out. And make sure that you get the appropriate amount and get all the bubbles out. Okay, so you can mix medication in one syringe. So the first thing you want to do is make sure that the two drugs are compatible. So there are ways that you can find this out. You can look on your Nursing Central. Most units in the hospitals have charts or some place that you can go and look up the medications to make sure that they're compatible in a syringe. So you don't want to mix more than 2 drugs in one syringe. So when you get ready to inject the medication, you're going to swab off the vial. You're going to have already calculated how much of each medication you need. You're going to pull back on the plunger the amount of air equal to what you're going to inject into both vials. So then you're going to inject the air into the first vial, and into the space above the solution, not the solution because that could cause you to inadvertently draw up some medication that you don't need. And then you're going to you're going to inject the air into vial B, and then you're going to turn it over, and you're going to withdraw the correct amount from vial B into the syringe, and then you're going to take that out, and you're going to put your needle into vial A and withdraw the correct amount from vial A. So just make sure you notice there that the tip of the needle is always in the solution. That helps to keep you from getting getting air bubbles in your syringe. All right, and here, this is just an example of mixing insulin. You do the same thing, but because you have, if you have NPH and you have regular insulin, NPH is cloudy, regular insulin is not, and so you want to draw up the air in the correct amount that you're going to give, put into both vials. So first you're going to inject the air into the NPH vial, and then you're going to inject the air into the regular insulin vial. And then you're going to draw out the regular insulin out of that vial, and then you're going to take the needle out, and each time you would enter the vial before that, you would swab it with an alcohol wipe. And then you're going to put the needle back into the vial of NPH and withdraw that amount. So I do want to tell you, so that putting the air in creates a negative vacuum, so that helps to withdraw the medication slower or easier. So sometimes you'll go in, you have a multi-dose vial, and you stick the air in, and it immediately comes back. And that means people have put air into that vial without withdrawing the proper amount, so the air stays in there, so then you've got too much air. So always make sure you only put in what you're going to take out, and that you take that amount back out. So some medications are not stable as liquids for a long period of time, so those medications will come in powder form, and you have to reconstitute those. So you have to look at the package directions to find out what it says about what kind of diluent you need to use. Sometimes, some of them will use normal saline, and sometimes they'll use bacteriostatic water. And you want to make sure that you follow the directions on that. So you're going to draw out the proper amount of diluent, just the same way you drew up your medication. You're going to inject the air, turn it over, pull that diluent out, and then you're going to go to the vial with the powder, going to swab off the top of it, put that syringe down in there, and you're going to inject that fluid down into that vial so that the fluid and the powder mix. Sometimes you have to swirl it a little gently in your hands, but most of the time it'll dissolve right away inside the vial without you doing much to help it out. And then you'll go from there, you'll withdraw it like we just talked about, where you turn it over, keep the needle inside the solution, and withdraw the fluid out in the proper amount. So for subcutaneous injection, this is medications that are administered into the adipose tissue that's just below the epidermis and the dermis. So the most common type of subcutaneous injection is insulin, but we also use it for Lovenox, which is a low molecular weight heparin, and for blood thinning. So you can use a variety of sites. You can use wherever there's a little subcutaneous tissue. So the best places are the outer aspect of the upper arm, the abdomen, avoiding the area around the belly button. You can use the anterior aspects of the thigh, the upper back, or the upper ventral or dorsogluteal area on the buttocks. And so this slide on the left is just showing all of those different sites where you can where most people have enough subcutaneous fat where you can inject medication into it. And then the one on the right is where you would give Lovenox, which is the low molecular weight heparin. So again, you want to avoid that umbilicus. You always give this medication in the abdomen or right around the back side. So the equipment that you need to choose your needle length based on the amount of subcutaneous tissue present. Some people have more than others. So you can go straight in with a needle for subcutaneous injection on people who are overweight. But for people who are thin and have no subcutaneous tissue, you might have to go more of an angle on those patients. And you would never inject more than 1 milliliter of solution subcutaneously. It's just not enough space for more than 1 milliliter. So when you get ready to give it, you're going to give the medication either at a 45-degree or a 90-degree angle. Like I said, if they have more subcutaneous tissue, then you can go more at a 90-degree angle. And you're going to choose your needle or choose your angle based on that and the needle length. So shorter needles, or 3/8 inch needles, should go in at a 90-degree angle, and 5/8 inch needles should go at a 45-degree. So you're going to, for thinner patients, you'll pinch up the skin. We're going to demonstrate this in class and you'll practice. You do not aspirate. There's not enough blood vessels in that area to worry about getting it into a blood vessel. You give the medication and remove the syringe, and you just hold a little pressure there. You don't massage it in. We used to always massage medications in. Now they found that only serves to damage the tissue under, that where you've given the medication. It doesn't really help the medication be absorbed. So you're just going to hold gentle pressure there. So this is just showing you a patient on the left is giving himself an injection that looks like an insulin pen in the abdominal area. And then on the picture on the right is the insulin pump. So you don't think about this as being a subcutaneous medication, but it is. It's the patients that use the insulin pump have a little injector that they put into the subcutaneous tissue, and then they tape it down and it stays there for 3 days before they rotate the site. So giving medications intramuscularly or IM gives a little bit faster absorption than the subcutaneous medications. So it goes into the muscle. So they have a greater blood supply, so it's more readily absorbed and has a faster onset than subcutaneous. Not as fast as intravenous, but faster than subcutaneous. So there are certain landmarks that you have to use, you have to follow to avoid hitting major nerves and blood vessels. You want to give no more than 1 milliliter of solution into the deltoid site, so that's in the arm. So if you have a medication that's more than 1 milliliter, then you have to choose a different site to give the IM medication. And we're going to look at those sites in just a minute. And you want to choose the appropriate needle based on the injection site and the patient's age, and then the appropriate gauge. So the gauge is, the length is how long the needle is, and the gauge is how big the diameter is. So thicker medications need a larger diameter. Not as thick medications, thinner medications can use a smaller needle. So Z-Track is a special method for giving IM medications, and now they're recommending that you use Z-Track on almost any IM medications to prevent irritation of the subcutaneous tissue. So we're going to look at that in just a minute. Again, you don't massage the site, you just want to hold gentle pressure after you're done. And it's no longer required to aspirate back, but you want to check the medication manufacturer's recommendations before you decide whether or not you're going to aspirate back. But generally, you do not have to aspirate. You always want to use a darting action when you enter the muscle tissue. I've seen students, we talk about it before we go in the room. No, I'd say, now tell me how you're going to give this, and they're going to say, I'm going to use a darting action with my wrist. And then they get in there and they dart until they get right to the skin. And then I guess they get freaked out or something, and then they just push that needle in. And that's so painful for the patient. So you want to use that darting action to get that needle into the muscle. You want to hold the needle in place for at least 10 seconds after you've given the medication to make sure that the medication has dissipated into the muscle, and withdraw the needle at the same angle as it was inserted so that you don't damage the muscle. And you never want to recap the needle. You always will teach you how to dispose of those needles safely. So here are the sites. So the ventrogluteal site is and the vastus lateralis. Those are the most common ones. So the ventrogluteal is A, and the vastus lateralis is B, and then the deltoid is C. And we used to use the dorsogluteal, which is the buttocks, but we don't do that anymore because of there was too much nerve damage. So in class, we're going to talk about how you find the landmarks for these different sites. So you can refer back to this picture, but we'll talk about this in Skills Lab. So here are the different angles where you could go in for with your needle. So let's start at the right-hand side. We haven't talked about intradermal yet, but that's like your TB test. So you've all had one of these, and that is where the medication goes right under the skin, not in the subcutaneous tissue. And then moving a little bit to the left is your subcutaneous, can go in at a 45-degree or a 90-degree angle. And then your intramuscular can go in at a 90-degree angle or 72 degrees. Most people use the 90-degree angle, but it gets it down into the muscle. And here's Z-track. So with Z-track, what you do is you use one hand, the hand that's not going to hold the syringe, and you pull the skin back, and then you use the other hand to do the darting action, get that needle down into the muscle. You inject the medication, you hold it there for 10 seconds, you pull out with that needle, pull out the needle and syringe out, and then you let go of the hand that was pulling the skin back. So what that does is that covers over that area of skin where you gave the medication so that the medication doesn't seep back up into the subcutaneous tissue. It doesn't damage the subcutaneous tissue. So here's a question. Tell whether the following statement is true or false. The recommended intramuscular site for an adult is the vastus lateralis. And that's false. The recommended site is the ventrogluteal or the deltoid. But again, the deltoid can only hold 1 milliliter of medication. So intradermal is just like with your TB test. It's administered into the dermis, just below the epidermis, just below the skin. It does have takes the longest for that to be absorbed of any of the parenteral routes, and it's usually used for sensitivity tests like your TB or for some local anesthesia if they're going to stitch up a cut or something like that. The body's reaction to any kind of substance that you put in intradermally is easily visible because the reaction will be right there on the skin. So common sites that they use are the inner surface of the forearm or the upper back under the scapula. You'll use a very small, short needle, and it needs to go in at the angle of 5 to 15 degrees, and the bevel needs to be up to enter when you enter the skin in order to get it to make that little bleb under the skin. So here's an example. So in the top left picture, that's how you're going to hold the patient's arm, and then you're going to insert the needle at that like 5-degree angle with the bevel up and inject the medication there right under the skin until you get that little bleb or wheal is what some people call it, just right under the skin. And that little bleb will go down over time. So wherever you gave that medication, you want to make sure that you mark that site so that when you come back to check to make sure to see if you've had a reaction to it, then you know exactly where you have given the medication. So you just take a skin marker or a Sharpie and draw a circle around this site. So we're not going to talk about intravenous medication this semester because you're going to learn that next semester. But intravenous medication administration delivers the drug right into the bloodstream, has an immediate effect, and can't once you give it, you've given it. You can't recall or change any of the action of the medication. So it's the routine that's used most often in emergency situations and for a variety of other reasons as well.